Hello, my name is Teresa Hernandez and I'm a student at United States University. I'm going to be doing the assessment for abdominal on my patient and I will be uploading this to YouTube. So right now I'm going to get the consent from my patient for upload to YouTube. Can you state your name please?
Tomas.
And what is your date of birth?
7/13/90.
And how old would that make you?
32.
Okay, and do you consent this video to be uploaded to YouTube
Yes.
for educational purposes?
Yes.
Okay, so he consents and I'm gonna go ahead and wash my hands and I'm gonna position my patient on a supine with some pillow, with the pillow underneath his legs for comfort. And also, did you empty your bladder today?
Yes.
All right, thank you. Okay, pillow. Go ahead and lay back and with your hands on your side. So now I'm going to go ahead and start on the inspection of his abdominal. And can you uncross your legs for me? Thank you. And I'm going to first note the color. It is appropriate for his ethnicity. And also I'm going to note for any scars, any stria. There's none. So also I'm going to be noting for any hernias in the umbilicus area or any inflammation, which I don't see any. And his contour and shape is symmetrical. No bulging. And also no ascites. I don't know any ascites at this moment. And his liver doesn't seem bulging. The spleen, it's within normal. There's no tumors. No, are you okay?
Yes.
Okay. No waves or GI obstructions. I don't know any palpations either at this moment, and no aneurysm. So I'll go ahead and start the auscultation part, and I'm gonna use the diaphragm of my stethoscope and listen to for the bowel sounds. I'm going to start on the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And all bowel sounds sound about normal. There's no abnormal findings there. So I'm going to go ahead and auscultate the arteries, which I will start with the aorta, which is located in the mid-clavicular to the left, slightly to the left. I'm going to start with my diaphragm as well. Aorta artery. I'm going to move down to the renal arteries, left renal artery, right renal artery, right iliac artery, left iliac artery, and move down to the femoral left artery and right femoral artery. So now I'm going to go ahead and switch over with my bell and listen for all the arteries as well. Again, starting with the aorta, mid to slightly left. Moving down to the left renal artery, right renal artery, right iliac artery, left iliac artery. Now I'm moving down to the femoral artery. This will be the left femoral artery, right femoral artery. So no bruising noted. I'm gonna go ahead and start with the percussion, and the normal findings will be tympany. So I'm gonna start with percussing all 4 quadrants. Left upper quadrant, left lower quadrant, and I did on this side was the right lower quadrant and the right upper quadrant as well. So since I'm already percussing and I'm in the lower area, I'm gonna go ahead and do the bladder, and since he already emptied his bladder as well, I'm gonna note if there's any dullness or tympany, okay? And Tiffany is noted. So I'm gonna go ahead and move up to the spleen to know if there's any abnormal findings, and at this moment it would be normal to hear dullness in the spleen. And this is located on the left upper. Okay, so dullness is noted. So I'm gonna go ahead and move over to my right side, which you'll find the liver, and we're gonna be percussing as well. And at this moment, we're gonna be checking for any dullness and at the edges of the liver as well. So at the right bottom edge, it's located at the bottom mid-clavicular to the right line. So right about here, and I'm gonna go ahead and percuss at the very edge. Okay. Okay, so I'm gonna also measure the liver at this moment, and here, and my ruler, I'm gonna measure in centimeters, and it's about 7 centimeters, which normal size is 6 to 12 centimeters, which is normal. So now I'm gonna go ahead and put that to the side, and I'm gonna move over to palpating. I'm gonna go back to the abdominal 4 quadrants to check for any tenderness, pain. So if you feel any pain at any moment, just let me know, any discomfort or any tenderness. I'm gonna go ahead and start with the light palpation on the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. So that was the light palpation. So I'm gonna go ahead and palpate deep for any tenderness. So at this moment, let me know if you have any tenderness. So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. So I'm gonna go ahead and palpate the liver at inspiration to check if there's any enlargement. And so the liver, so go ahead and take a deep breath and let go. And take a deep breath again. So any tenderness? It didn't feel like any enlargement either. So I'm gonna go ahead and move over to the left side to check to palpate the spleen as well at inspiration. So then if I can have you take a deep breath and let out, and again, take a deep breath and let go. Good. All right. So no enlargement noted. So once I'm done with this, I'm gonna go ahead and have my patient sit up for a moment just to check for the CVA, coastal vertical braid angle. I'll come around from this side, and I'm gonna be checking his CVA for any tenderness. And did you have any tenderness or pain at that time? No? Okay, so go ahead and lay back down for me. So now I'm gonna move over to another specialty test, which is the McBurney. So this is gonna be checking for any possible appendicitis. To locate the appendix, you wanna go from one to 1/3 of way between the ACEs and the umbilical cord. So umbilicus, sorry. So right in the middle, you'll find the appendix, and what we're gonna be doing, and I'm gonna press down, I'm gonna ask the patient to let me know if there's any tenderness. So when I press down, if you feel any tenderness or pain, let me know, okay? And any tenderness? No. So there's negative McBurney's. So now I'm gonna go ahead and do another specialty test, which is the Murphy sign, and this is gonna be for the gallbladder, and this is located at the right upper quadrant. So what I'm gonna do, I'm gonna also have my patient take a deep breath, and then I'm gonna press down, okay? So let me know if there's any pain or tenderness. So go ahead and take a deep breath. And release. And there any pain or tenderness? So that's a negative Murphy sign. I also didn't feel any enlargement either. So now we're going to go ahead and do the ascites fluid wave test. So for this, I'm going to have my patient take his left hand, put it right in the middle, and this is going to check to see if there's any movement in the belly for any fluid. So, and that is negative for ascites. And that concludes my assessment for the abdominal. Thank you for your cooperation. And